Hi, my name's Angela Baker. I'm going to be doing my speech on cleft lip. 17 years ago almost, I had a baby girl who had cleft lip. I was young. I had never seen cleft lip, cleft palate. I had never even heard of it until the day that they brought my baby into me. I started crying. The doctor explained to me, I think there's 1 out of 700 or 1 out of 1,000 babies that have cleft lip or palate or both. But that was the first time that I'd ever seen it, and my baby girl had it. So it was quite the surprise and a long road ahead of us for the next few years. I'm going to try to zoom in on this picture. There's a couple of them of when she was first born. Well, she was a couple months old. It was before she had her surgery. Here's one of them. If you notice, I could get it straight here. You can tell above her lip up to her nose that there's a space between it. Might be a little easier on this picture if I could align it right. There, you can see it better on that one. That was before she had her surgery. She had her surgery when she was 2 months old. A baby born with cleft lip can also have cleft palate. These defects are facial and oral malformations. They result when there is not enough tissue in the mouth or lip area, so they do not join together properly. Cleft lip and palate can occur on one or both sides of the mouth. Because the lip and palate develop separately, it is possible to have cleft lip and cleft palate, or one or the other. The cause of most cases are unknown. Scientists believe that they're due to a combination of genetics or environmental factors. If a family member has either cleft lip or palate, then the risk of a newborn having a cleft lip or palate is greater. Another belief is it's a result of exposure to viruses or chemicals while the fetus is developing in the womb. In other situations, either deformity may be caused by a medical condition, or there's certain medicines out there, if the mother takes them while she's pregnant or before she's pregnant, then they believe that that could be the cause. The most common problems associated with cleft lip and cleft palate are eating problems, the way that the baby can't really chew up their food, and I'll go over that, speech and dental problems. When a child has cleft palate, they have a separation or opening in the palate, kind of just like I had showed on my daughter's lip, but they have that on the inside of their mouth, on the top of their palate. Foods and liquids can pass through the mouth back up through their nose. You can use specially designed baby bottles and nipples that help the fluids flow down towards the stomach. They also may need to wear a man-made palate to ensure that the baby receives adequate nutrition until surgical treatment. Children may also experience trouble speaking. Their voice may not carry well. It may have a nasal sound, and they may be hard to understand. Not all children experience this problem. Surgery can sometimes fix their speech. If it doesn't, then they usually work with a speech pathologist when they start school. Children with cleft lip are more prone to cavities and more often have missing, extra, malformed, or displaced teeth, which all require dental and orthodontic treatment. Due to the number of oral and medical problems children with cleft lip and or palate experience, they will have to work with a team or 12 up to 14 doctors of different types. They range from plastic surgeons to dentists to psychologists. Cleft lip may require 2 to 3 surgeries, possibly 1 if it's not very severe. Cleft palate, on the other hand, requires many surgeries, and it can take years. They require surgery to fix the palate, and then they may need a bone graft. The child requires surgery to help improve their speech. Other surgeries include improving appearance of the nose, lip, to close the opening between the nose and the lip, and to help breathing and stabilize and reline the jaw. To sum up my speech, I'm going to tell you about my daughter. Her first surgery, like I began the speech with, her first surgery was when she was between 2 and 3 months old. We went to the hospital. The surgery was supposed to take, I believe it was 1 hour to 2 hours, and it took 3 or 4 hours. It was very nerve-wracking. After her surgery, she had to be fed with a syringe. She had a piece of tape over her mouth, and she had to wear little casts, and I have a picture here if I can reach it up there. That's her with her grandpa. And there's my poor little girl after she had her surgery. The feeding her with the syringe was very hard because she can't suck. She had stitches, so they wouldn't allow her to suck. That was for 2 weeks. After she got the stitches out, it was kind of hard for her to start sucking on the bottle again. After her surgery, they took the stitches off. This is her newest picture. Sorry, I'm really bad with this. I mean, you could barely tell when she was a baby. Now that she's grown up, you can kind of see the scar tissue. She had another surgery when she was in 4th grade, and it was probably harder than when she was a baby. She at least she could talk more and express her pain, and she had to eat light fluids. I had to feed her through a syringe also at that age. Cleft lip and cleft palate are more common than we realize. But just to sum it up, I just wanted to let everyone know out there that this is something that occurs more often than we realize. Thank you.